Since 2018, Premier Ford has been a tremendous supporter of Middlesex-London Paramedic Service and for paramedic services across Ontario. I would like to take this opportunity to express my sincere appreciation to you, Premier Ford, for your continued support of Middlesex-London Paramedic Service. Premier Ford and his government have and continue to address long outstanding issues in healthcare and paramedic services in Ontario. Your government is always ready to listen and consult in addressing issues and recognizing the importance and professionalism of paramedics who are always ready to respond to the needs of our community. Premier, the investments made by your government since you took office have truly been an acknowledgement of the important work of our paramedics and demonstrate your desire to continue to invest in Ontario's healthcare system. Middlesex-London Paramedic Service has been privileged to receive your investments from your government. Some of these investments include the Pediatric Neonatal Intensive Care Transport Unit, large investments in community paramedicine, and I might add the largest. When I started with community paramedicine, it was $6 million. I believe your government Premier has invested over $200 million in community paramedics. So thank you for that. As well, your government has ensured that we have had the support we needed, especially during COVID. Premier, I recall that at the height of COVID, our warden, Cathy Burghardt-Jesson, who's here today, wanted to ensure that Middlesex County and the City of London residents were well served by mobile swabbing clinics and mobile vaccine clinics. You did not hesitate to provide the necessary support for our ideas and, more importantly, the implementation that was necessary at such a critical time in Ontario's history. Premier, Minister Jones, Minister Dunlop, thank you so much for what you do each and every day to make Ontario a better place. We look forward to today's announcement and, more importantly, continuing the important work and support that you provide to Middlesex-London Paramedic Service and to all residents of Ontario. Once again, thank you and welcome to Middlesex-London Paramedic Service Headquarters. I'd like now to ask Deputy Premier and Minister of Health, Sylvia Jones, to please come forward.
Well, good morning, everyone. It's great to be here in London with Premier Ford, Minister Dunlop, and of course MPP Rob Flatt. I also want to thank our hosts, the Middlesex-London Paramedic Service. Chief Roberts, you have played, and your entire staff, you have played such an important role in helping Ontarians get the care they need, and your efforts did not go unnoticed during the pandemic. Our government is focused on connecting you to care closer to home. We've been working together with our partners to ensure we are growing our healthcare workforce, not just for today, but for the future. We have already made great strides in bringing more internationally educated nurses to Ontario. We've broken down barriers to make it easier for them to come practice here in Ontario, and our plan is working. Last year was a record-breaking year for nurses registered here. With over 12,000 new nurses ready to work, almost 6,000 of them were internationally educated. This is in addition to the pipeline for future talent in our colleges and universities that I know Minister Dunlop will speak more about. Just yesterday, we announced that we are also making it easier for Canadian-trained healthcare workers to come work in Ontario. A doctor from British Columbia shouldn't have to jump through hoops to start working here in our province. Ontario leads the country as the first to implement these as-of-right rules, with all of the goal of making it easier for you to connect to care closer to home. Because we know the status quo isn't working. We need to move forward with fresh and bold ideas to address more healthcare professionals in Ontario. Because when it comes to your health, our entire province is stronger when you have access to the care you need, when and where you need it. And we will continue to work with our partners to make it easier, faster, and more convenient for you to connect to care no matter where you live in Ontario. Thank you, stay well, and it's now my pleasure to pass it over to Minister Dunlop.
Well, good morning, everyone. It's great to be here today alongside Premier Ford and Deputy Premier and Minister of Health, Sylvia Jones. We are all keenly aware that the COVID-19 pandemic has demonstrated how vital healthcare professionals are to the health, long-term care, and the well-being of the people of Ontario. Through Ontario's plan to stay open, our government has taken the necessary steps to strengthen the supply of healthcare professionals in every corner of the province. And we recognize that investing in the future of Ontario's healthcare system starts with expanding high-caliber education for those on the front lines. I've been working closely with the Premier and the Minister of Health to ensure that we are not only fostering education for healthcare professionals, but that we are also addressing specific regional and community healthcare needs across the province, especially in this time of need. This includes expanding medical school seats by 160 undergraduate seats and 295 postgraduate positions over 5 years, as well as an additional 1,500 nursing spaces beginning in 2023-24. And as part of our government's plan to stay open, we introduced the Ontario Learn and Stay Grant, which addresses the pressing needs for qualified professionals in communities across the province. The grant launches this spring for the upcoming fall 2023 academic year. It will provide upfront funding to cover the costs of tuition, books, and other educational costs to post-secondary students who enroll in priority programs in regions that have been challenged by staffing shortages. And importantly, commit to working locally when they graduate. This means that these students will graduate with no debt tuition if they work locally in their fields after graduation. Not only are we giving students the training for in-demand fields in Ontario, we are also ensuring that communities across the province get the workers they need to support their local labour market needs. Let's look at London, for example. Through the Ontario Learn and Stay Grant, graduates of Fanshawe College's nursing programs will be able to make immediate impacts in local hospitals, like the London Health Sciences Centre and St. Joseph's Hospital, long-term care homes, and other facilities. This is an historic investment in our students and in the future of our healthcare workforce in Ontario, and will be a game changer for communities across the province. As we continue to prioritize a strong healthcare workforce in the years ahead, training the next generation of healthcare workers has never been more important. Thank you, and I'll now pass it to Premier Ford.
Well, good morning, everyone. I'm thrilled to be back here in London alongside Minister Jones, Minister Dunlop, and MPP Flack. I got to tell you about MPP Flack. Just an incredible person. We're fortunate to even have him here, a great business person here in the London region. And again, Rob, I'm always grateful for your leadership. Who does a fantastic job, as I was saying, representing the people of London at Queen's Park. And it's great to have Mayor Morgan and Warden Cathy. Again, great to see you. Mayor, congratulations, being the new mayor of London. I had a great rapport with the previous mayor. I want to start by giving a big thank you to Chief Roberts. You know, I've said many times about thinking outside the box. First of all, I love the paramedics. They always think outside the box. They always go in there in a crisis situation. They don't need to be told to do this, to do that. They just get it done. And Chief Roberts is a true leader with the paramedics right across this province. And I just want to thank you, Chief, for your leadership, and everyone at the Middlesex-London Paramedic Service for hosting us today. You have a bunch of champions here. You really do have a tremendous team here. We're so grateful for all the work you put in and day out. Over the past several years, our first responders in the healthcare system are paramedics, emergency medical technicians, nurses, and the list goes on and on. They did an incredible work. Each stepped up and continue to step up to keep people and communities safe and healthy. The past several years also taught us, when it comes to your health, the health of all Ontarians, the status quo is no longer acceptable. We need to be bold, we need to be innovative, we need to be creative. We need to look to other provinces and countries to see what they're doing differently and borrow the best ideas. We also need to be clear. Ontarians will always access health care with their OHIP card, never their credit card. Our goal is simple. Whether it's an emergency in the middle of the night or a problem that's been bothering you for years, no matter where you live, we want to connect you to more convenient care closer to home. Together, we've come so far. Since 2018, over 60,000 new nurses and nearly 8,000 new doctors have registered to work in Ontario. In fact, last year was a record-breaking year for new nurses in Ontario, as you heard the minister say, with over 12,000 new nurses registered and ready to work, and another 30,000 nurses studying at a college or university, providing a pipeline of talent and reinforcements. We've added 3,500 hospital beds with another 3,000 more under construction. We're helping 30,000 more seniors find a long-term care home, and we're upgrading another 30,000 long-term care home beds. But when it comes to your health, we must do more, and we're going to do more. Like I said, as we connect people to more convenient care, we need to be bold, innovative, and creative. And today, we're doing just that. When we released our first plan to stay open last March, we launched an innovative new program called the Learn and Stay Grant, starting with nurses. Learn and Stay pays for the cost of tuition, books, and other supplies. In return for a commitment to stay and care for people in underserviced communities. The program started with 1,500 students. We thought that's great. 1,500 students, that's fantastic. Today, I'm thrilled to announce the Learn and Stay grant will expand to 2,500 students. On top of nurses, the expanded program will now be open to others in-demand professionals, including paramedics and medical lab techs. We're bolstering our workforce, building a pipeline of healthcare talent for growing and underserved communities. Students can apply for full, upfront funding at select colleges and universities. If they commit to staying in their region, working for up to 2 years after graduating. That's right, we'll pay for your tuition, your books, and other direct educational costs for a practical nursing program in London, for a paramedic program in Sudbury, or for a medical laboratory program in Windsor. My friends, this is a real win-win. We're providing students with opportunities for a great education and a rewarding career. And we're increasing the number of healthcare workers in underserved communities so that Ontarians in every corner of the province get the quality of care they need closer to home. As I said before, the status quo is not acceptable. A lot of people out there, they want to have this endless debate about our healthcare system, and you've heard it for decades, not years, but decades. But the people of Ontario, all they want is action. We're being bold, we're being innovative, we're working hand in hand with our colleges, universities, and healthcare partners. We're making it easier, faster, and more convenient for you to connect to care, because it's about you, it's about your health. Thank you, and God bless the people of Ontario.
Okay, we'll now take questions. Just a reminder, it's one question, one follow-up. Premier Ford, this is Rebecca with London News Today.
Hi, Rebecca. How are you?
Good, thank you.
Good.
So one of the key reasons behind the nursing shortage that we've been seeing here in Ontario is that first responders are feeling a sense of burnout. So will there be any type of supports being offered to these professionals as these changes are being implemented to help those who enter the profession stay in the profession?
Yeah, before I pass it over to the Minister of Health, yes, there's burnout with the nurses. They're doing a great job. But I think a lot of people got burnt out over the last couple of years of this pandemic, no matter what sector. But at the end of the day, we had the largest gain we've ever seen with nurses, over 12,000 of them. And I just want to, again, I thank them all the time. I appreciate the hard work they do, but I'll pass it over to the Minister of Health. Thank you.
Thanks for the question. There is no doubt that during the pandemic, all of our first responders, everyone who continued to work through a very challenging time, were under stress. You know, there were things that we didn't know about COVID-19 that we now know, that we have comfort in, specifically related to nurses working in our hospital and in our community systems. We, of course, did give a $5,000 retention bonus as an acknowledgement of how challenging those times were. We will continue to support our frontline responders, regardless of where they work in community and the jobs that they do, because we understand that it has been challenging. We've learned a great deal, but everyone truly stepped up, whether it was our paramedics, our firefighters, our police officers, our nurses, corrections officers. The list of individuals who went above and beyond to protect the citizens of Ontario was not unnoticed by our government and their friends and neighbours. Thank you.
Jennifer Beam in the London Free Press. We're doing a lot of cool things in London right now with ambulatory care. Our hospital, LHSC, has a surgery centre across the street from its main, Victoria Hospital. St. Joe's is doing similar things. Is your intent to prioritize these sorts of hospital-run ambulatory care initiatives over, before investing in more private or for-profit community surgical and diagnostic centres?
Well, we want to support everyone across the board. As I've said, we've been pouring money in. Since 2018, we've put over $14 billion into healthcare. But again, and I apologize, the best person to answer this is the Minister of Health. Thank you.
Yeah, thank you. It's not an either-or. We know that we have people who are waiting too long for cataract surgeries, for hip and knees, and that is an impact on those patients, those individuals, because they want to be part of community. They want to be back with their families, back in community, volunteering, working. And so for me, it is how do we make the system stronger? And the way to do that is not only to absolutely invest in our hospital system. We did that with a surgical recovery fund of $300 million that actually allowed hospitals, when they had the capacity, to expand their operating room hours. But we've also done it now with expansions in additional cataract surgeries that could be done in community. And I have to tell you, as recently as last night, I was talking to an individual who had their cataracts done last week, and they were grateful that they would not have the long wait times that we are unfortunately seeing in the province of Ontario. So we will continue to work with our hospital partners to expand their ability to offer surgeries in their operating rooms, but we will also expand community opportunities, because we know that there are over 800 that are existing in the province of Ontario. They're doing excellent work. We just need more because we have a growing and aging population.
Just this week, London City Council, Middlesex County Council, we're discussing ways to push the province to really kind of revitalize and change the way paramedics do their work here. They want the province to green light things like treat and release protocol changes and, changes to the way dispatch is managed locally, and along with the ability to drop patients off at places other than an ER. I just wanted to know if this is something you're entertaining as a government, sort of changes to paramedicine to make things a little bit easier for this sector.
Yeah, and I'm probably going to pass it over to the mayor or the warden on this one, but we had that discussion up there about the dispatch and a few other areas, but we're always open. I always say, at Queen's Park, we always listen to the professionals, no matter if it's the healthcare frontline workers or the CEOs or the paramedics. And when you come to a great city like London, no one understands their city better. For instance, the mayor, the warden, MPP Rob Flack, they understand it. That's where we take our lead, and I just don't believe in Queen's Park sitting there dictating to a region without their collaboration, cooperation. So, warden, mayor, who wants to step up, or you both can come on up to the mic here.
Well, thank you very much for that question, Jennifer. It's great that both the mayor and myself as the warden can be here, because As much as Middlesex County is the service provider for paramedic services, this is a partnership. And I can assure the residents of the city and of the county that together we are having discussions with the province to try and get these innovative and out-of-the-box programs into the Middlesex-London region. Treat and refer, alternative destinations, these are key to making sure that the bottlenecks that we're seeing in emergency can be addressed. Middlesex-London Paramedic Service wants to be a partner in this, and I can assure you that ongoing discussions are going on, and we are confident that we will have announcements soon.
Yes, and I'll just add that the county is the service provider, and the City of London is one of the major funders of the service, and we work in lockstep in our desire to improve the service, to be innovative, to work with the province to find new solutions like the warden mentioned. This is something that we've done for the first time. When we had delegations to AMO with Minister Jones, we did it together with the county, the EMS service, all coming together, making these asks that are well researched, well thought out, and are in dialogue with the province. And I do believe the province is open to innovation and change in the system, which will help us control costs, which will help us improve the system and provide better service and care to those Londoners and those in the county who need it.
Thanks, Mayor.
Thank you.
If I could just briefly add, we are absolutely doing a lot of these programs. They are application-based, so as communities, as leaders like Chief Roberts come forward with these proposals, we are absolutely endorsing them and having them come forward. You know, I have to speak specifically about community paramedicine. It is a program that is truly allowing people to age safely in their home. They have that touch point with professionals that they trust, that they know, and it ensures that they are not having to go to emergency departments. It is an incredibly successful program that we've had as pilots for many years. I know Chief Roberts has been a huge advocate of it here locally, and we're continuing to expand. But they are partnerships that, as they come forward from the various municipalities and paramedic services, we make sure that we quickly assess them and approve them because we know they work.
Hi, Premier Ford. This is a question for you.
Yes.
The Integrity Commissioner is now investigating your government's decision to open up parts of the Greenbelt. The timing of some land purchases has raised questions about whether developers were tipped off. Are you confident that no one in your government gave a heads up to the developers?
Well, I'm confident no one gave anyone a heads up. At the end of the day, we're going to have 300,000 people landing here in Ontario. Over a 10-year period, we're going to have 3 million people. I just want to clarify a couple things. There's a little misnomer out there that this was government land. It's not government land. It's private individuals' land that have the right to sell it to anyone they want. I'm going to repeat that. It's not government land. It's private land. And it's not just in the middle of some marsh or something. It's butt up against an existing community. So you have a community with all the services there on one side of the road. You have hundreds, if not thousands, of homes. On the other side of the road, you have an empty field. We have people coming here. We need to build homes. We're going to build homes. We're going to build the 1.5 million homes that we need over 10 years. We're going to work collaboratively again with the municipalities to hit their targets, and had a great conversation with the mayor, and he's confident he's going to hit his targets. That's the approach we need to take. The other approach is we sit back and do nothing like the previous government did for 15 years, and we have a housing crisis. We have rental crisis. We want to make sure that we give incentives to people to build rentals. We want to make sure that they're building nonprofits and I always say attainable and affordable homes and regular homes. Folks, it's very simple. This comes down to supply and demand. You don't have the, you don't have the supply. Guess what happens to the prices? The prices start skyrocketing, and it doesn't help when the prices skyrocket and the interest rates are going up. And in some cases, and hopefully not here in London because I know they have a great city, in some cities it'll take 4 to 5 years to get a permit. What do you think happens in those 4 or 5, which is staggering to me, when you can go down to our friends in Ohio and get something in 6 months. But here in Ontario, we want to get to that 6 months, and we're going to start building homes. Simple as that.
There's a report this morning that the provinces are very close to a deal with Ottawa, a 10-year deal on health care. I'm wondering, from your perspective, how close that deal is and whether or not the announcement about more private clinic delivery has changed those discussions with the...
Well, to answer your last question first, no, that wouldn't change anything. But I always consult with 12 other premiers on this. And it's not going to be a one-off for Ontario, another for someone else. We've all agreed, all the premiers, we all have to work together and stay united, and that's exactly what we're going to do.
Okay, this will be the last question.
Sure.
Hi, Premier Ford. Brian Bicknell from CTV News.
Hi, Brian.
Hi. This week we learned that the budget increase for the local paramedic service is about 18%. It's $9.3 million. One of the issues is the very long and frequent offload delays at hospitals outside emergency rooms. I'm wondering how does this announcement help that immediate situation with offload delays, which keeps paramedics from being out on the streets responding to patients' needs?
Yeah, excellent question. And before I hand it again over to the Minister of Health and even the Chief, you know, I remember this back when I was in City Hall, 2010, making sure that we had a nurse there, because you go by the hospitals and the paramedics are absolute incredible. They're champions. But you see all the trucks parked outside the emergency department. We want to avoid that right across the province. That's why we're going to be hiring more paramedics. But Minister, if you want to come up, and maybe Chief, if you want to give your perspective on how it will help when we give the funding.
Thanks. It's a great question because it ties exactly back to so many of the initiatives that we are bringing forward. You know, a nurse offload program where we have funded a dedicated nurse who is in an emergency room so that the paramedics can actually release that patient under the care of a dedicated nurse and then ensure that they are back out on the road quickly. Those types of programs, even as early as this January 1, where we announced 13 minor ailment pieces that you could go to your pharmacist and get an assessment and treat the symptoms so that you don't have to go to an emergency room if perhaps you don't have a primary care practitioner or they're not available. So all of these programs together are really to ensure that our emergency departments are there when you have an emergency. And it also ensures that our paramedics, who are doing excellent work in community, need to be able to have those ambulances and that expertise out helping people in emergencies. So putting all of those programs together, we'll continue to work with our paramedics and our partners at the municipal level to make sure that we provincially have programs in place that will assist, because I know that when we do that, we make sure that paramedics are working at their core service value level, and that's to deal with patients who are in an emergency immediately. I'll turn it over to Chief Roberts.
Thanks, Minister and Premier. So quickly, Brian, obviously offload delays have been an ongoing issue, but they've existed since 2003, and certainly coming out of COVID, this government has having to deal with it. We've seen the increase, but we've been having ongoing discussions with the Premier and Minister Jones on innovative models, better ways to do this, as they've indicated, thinking out of the box, being creative. Certainly our treat and refer, treat and release, which the Minister announced, and alternative destinations announced at AMO last year, along with dispatch as well. The investment in community paramedicine, which is community-based care. So that way, if you can't get to your primary care physician, you're getting more preventative care in the community to avoid unnecessary visits to the emergency department. This is part of a comprehensive plan that the province has been working on, that we've been working with them in partnership, not only at the county, but also the city level with the mayor here. And certainly, we're looking for some progress and movement on those to address these long outstanding issues. Thank you.
Just to follow up, you mentioned community paramedics, and that's one of the ideas. Another one of the ideas is having paramedics treat and release so that patients who don't necessarily have to be in ERs end up in ERs, and that, of course, frees up paramedics. What do you think of some of these ideas, and would that involve changing the legislation and the rules around paramedics and their duties and what they're allowed to do?
So we've been able to do a lot of the innovations through changes in policy. And again, I want to reinforce that these are proposals that are brought forward to the ministry. We understand that different communities have different pathways. The ability for today a paramedic to be able to give an option to a patient and say, would you like to go to a long-term care home, or can we take you to a mental health facility instead of having to automatically take that individual to an emergency room, really empowers the professionalism of the paramedics to say, I know what is best for you right now, and if you agree, if you are in support, we can do that. We've seen incredible uptake. In fact, in St. Thomas, that have had this program for a number of years, the patient ability to get that treatment and that assessment elsewhere has led to an almost 80% appreciation. They really like the fact that they don't have to go to an emergency room if that's not where their treatment is ultimately going to be. So again, I will say, we do this in consultation. These are not things that we want the Ministry of Health to come down and say, thou shalt. We're working with individual paramedic services to make sure that they first have the capacity in community and within their own organization. But I can tell you, when we do it, it has worked very well, and we'll continue to expand those models. It was very well received by municipal leaders in August when it was announced, because they've seen in their own communities how effective it can be. Thanks.
Anyways, again, I just want to thank, first of all, the mayor and warden. You have a beautiful region, beautiful city. Chief Roberts, you're an all-star. Thank you. And your frontline paramedics, I think the world of them. I really do, and I'm just so grateful. Not only the frontline paramedics here, but right across the province. You're all absolute champions. I appreciate it, and I'll always have your backs. Thank you. God bless. Bye-bye.